I don't know. This just makes me feel uncomfortable.
It's supposed to be 3 minutes of uninterrupted eye contact. We have to start over now. I feel like you're not taking it seriously. Do you want a deeper relationship or not?
I do. I just feel like this is a weird way.
Just start the podcast.
Okay.
We'll do it later.
All right, everybody. Welcome to Sights and Sirens Back to Basic Podcast, where we take complex medical topics and we break them down and make them so simple that you have to do nothing but listen to our podcast to pass medical school.
Nope.
That is our 100%
Don't
guarantee.
do that.
What?
There's
No.
emails.
Oh, okay. All right. Never mind. Well, maybe that's not our guarantee, but we'll try to simplify things for people. Welcome, everybody. Today's sponsor is RegistryReady.com. Registry Ready is a national registry question bank website that offers free, actually like a couple thousand free practice questions to help you pass the national registry with your EMR, EMT, or AEMT, paramedic coming soon. So check them out at RegistryReady.com.
Tell me about these questions. Are they vetted?
They are vetted. They are written by test bank writers. You know what I mean? Like national registry writers. Like the guys who've written questions for the exam, medical professionals, those who work in the field. Lots of great feedback I've heard saying that these are very similar to the national registry. I think it's hard for question banks to, actually do exact questions. That's kind of illegal. But again, very close, and people have had a lot of success on their exam using their questions. So check that out.
How many users are currently involved, Chris?
Okay. There are about 6,700 people who are using RegistryReady.com.
That's a lot of people. It must be an excellent product.
It is. I think maybe you're getting at the fact that we own RegistryReady.com.
Yeah.
Okay. All right.
Fun, right?
All right. Yeah. That was good. That was good. No, yeah. So we actually do. We own RegistryReady.com. But again, free question bank. Lots of questions for you guys to check out. So do that. RegistryReady.com, powered by Sights and Sirens. So why don't you introduce today's topic for us, Jason? What are we going to talk about today?
Today I wanted to talk about the inflammatory response as a part of our defense, right? We have the immune response, we have the inflammatory response, we have mechanical barriers and physical barriers, and I want to talk about the inflammatory response specifically because I think it gets a little bit of a bad rap because we relate it to negative things way more often than we relate it to positive things. And I think if we can take a deeper look at how it works, we can also understand our treatment modalities for issues that involve the inflammatory response and then have a deeper understanding of the treatments that we do and the medications we do, and sometimes how those can be double-edged swords.
Sure. Okay.
We'll get into it. I think we're going to cover it all today, though, and it's going to go without a hitch.
Okay. All right. I mean, we can try. So I'll be honest with you. So when you said you wanted to talk about the inflammatory response, my initial reaction was, why? Let's not do that. Because it's just, I feel like it can be very complicated. And obviously our job is to simplify it.
Chris, I'm here to tell you that it's not that complicated. And I'm going to take it back to basics. That's the name of this podcast. That's why I created it.
Wait,
that's why I brought you on today with your question.
wait a second. Hold on. No. No, but honestly, like I said, I think people can get, it should be very simple, right? It's our body's defense mechanism. We're going to talk about that. But there's so many different things that are involved, right? There's so many different white blood cells and so many different things that are happening. How do we take this, Jason, and make it simple for people?
Well, we're going to take it back to basics today. No, and You know what? It's interesting that you say that because I think a lot of times, especially pre-hospital providers, we avoid topics like this. We avoid hematology. We avoid immunology because we're like, that's sciencey crap that I don't need to deal with. I'm about boots on the ground, stop the bleed. And it's like, no, we are called to be clinicians. We're called to be, understand the advanced science behind this and the pathophysiology. And I think you'll find, at least by the end of today's topic, why that edifies you when you're boots on the ground and you're doing simple treatments. Sometimes simple treatments, it's not just mash button A or push drug A and that fixes everything. We have to understand what those treatments do, both bad and good. And if we don't know what the body's doing, you often say that we're never going to be able to really beat the body out in terms of how good the body is at healing us, right? Mm-hmm. So when we're messing with the body's mechanisms, we need to understand that there's risks involved and then there's also advantages to us. So I just think it clears things up, and this is why I like to kind of jump into this stuff, is that the topics that typically people want to avoid, but I think we can make it simple and kind of fun and interesting.
Absolutely. So. Well, and I think too that is, and I think you probably agree with me on this, is that the difference between a just general EMS provider or emergency provider, even myself as a physician, between someone who's just, the average one and the one who's really good at what they do is understanding of things like this, right? And it may look like on the surface we're doing the exact same thing, right? I push drug A when you push drug A. I push drug B when you push drug B. We know how to do that, but when one of us knows the real reason why we're doing that, the underneath the pathophysiology. I think that's what sets apart a really good clinician.
Well, and that's when an expert, when you become an expert, and then a wrench gets thrown into things, and you hit the low incident, high risk type situations where maybe there's a reaction happening, or maybe there's just something that's kind of a little bit lower statistics is happening, and you have that base knowledge, you're able to recognize those things faster and then adapt and overcome.
Absolutely.
And that's why it's important. So I wanted to start today and maybe you can kind of paint the picture for me. What I'm getting at here is I think inflammation gets a bad rap. When we think of inflammation initially, what do you usually think of?
I usually think that I need some Motrin and I need some ice and I need to get rid of that inflammation, right? That's what we all think.
And you usually combine it with injury, right? Like, hey, I hurt myself, it's swollen, and now I want to ice it, I want to get rid of it. It's a symptom of like a disease process or an injury process that we want to take care of, right? Yeah. And that's not what inflammation is. Inflammation's here to help us. We're going to learn that through, as we kind of look at the different ways that inflammation helps. But we do look at it as the bad guy a lot, and we try to treat it. Why? I mean, in terms of like why do we want to treat inflammation?
Well, and I think, like, so kind of what you're getting at is that people we think that we need to treat inflammation because inflammation's bad. The reason we treat inflammation is because it causes people discomfort, right? So if someone comes to me and they said, "Hey, I'm in a lot of pain," or I twisted my knee and it's swollen and it's hot and it's hurting me, and I say, "Okay, well, here's some anti-inflammatories and here's some ice and that sort of thing." I'm treating inflammation because I'm treating that patient. I want that patient to find comfort. I want to obviously like alleviate pain, that sort of thing. But it makes it seem like, oh, well, I'm treating a problem the same way I treat like a pneumonia, right? Like, here's antibiotics to treat a pneumonia. I need to get rid of pneumonia. It looks like that, right? It looks like I'm giving you therapies to get rid of your inflammation, which
fix, yeah.
I am. But again, like, that makes inflammation look like it itself is the problem. Right. Where I think, like I said, what you want to get into is that it actually is a extremely important mechanism our body uses to help us and heal us.
In my mind, it's one of the three major defenses of our body, right? When our body is not at homeostasis or it's in a disease or injury process, we have basically three things in my book that, and again, people, there's nuances where people say that, inflammation is really a part of the immune response, or, your physical barriers are a part of immunity. I like to just keep it simple, take it back to basics, divide it into three parts, right? Sure. We have physical barriers that protect us from disease and injury, right? Mm-hmm. You've got your skin, you've got your mucous membranes, you've got boogers, you've got all kinds of things that can protect you, right?
Sealed weapons, samurai swords.
No, that's not what I'm getting at.
Okay, that's a fourth.
Okay.
All right, sorry.
So physical barriers, right? Then we have the inflammatory response.
The most important one being your skin, right? Like, your skin is like the most important. Yeah, exactly.
So, but then when those fail, now we're exposed to injury of tissue or an antigen or a foreign body that's in our body, right? And we'll talk a little bit about that. But that's when usually our inflammatory response activates as sort of a frontline defense. Mm-hmm. And then we have a more specific immune response, right? The cell-mediated response. This is like when we're fighting COVID-19, or we create antibodies and we attack that specific disease or that specific injury, and we're doing things to that specifically. So the immune response is a couple things.
And it goes very general to very specific, right? So the general, just general barriers that block anything that shouldn't be there out.
Right.
And then the inflammatory response, or that second line of defense, which is a general inflammatory response. Like, it's just a general, which we'll talk about what it is.
Method, right?
Yeah,
no matter what it is, we're going to do these things.
Yeah, let's get cells there to help here. And then our body, creates certain specific things and finds specific cells to fight specific diseases. But again, it goes from general to very specific.
And that takes time, right? It takes time to build antibodies. It takes time to ramp up the immune response to the point where we're winning the battle. Like, we start losing it, right? Mm-hmm. There's an antigen. We've been exposed to it. We're fighting it. We're losing the battle. Eventually, we can make enough antibodies or unlock that key. Our body figures out a way to break down this pathogen and kill it. That takes physical time. So our stopgap, or what saves us a lot of times in the meantime, is your general inflammatory response.
Do you want to talk about quickly, define for people, antigen, pathogen, allergen?
I very much do.
All right. Well,
so an antigen is anything that is like a foreign in the body, that's flagged as not us, right? So our body's cells have markers on them, like little flags that tell us, like, hey, I'm a part of Jason, right? I'm a part of Jason, I'm good to go. And an antigen is really anything that's not flagged as me. Now, this is where we can run, and we can do a whole other podcast. I think it'd be great to do some immunological stuff and talk about that more in depth. But this is where, like, if you give me your kidney, right, that's not flagged as me. It's flagged as Chris. So thanks for the kidney, but now my body's recognizing that as foreign. And then a lot of times my body then activates things like the inflammatory and the immune response to fight that, thinking it's a bad guy, right? Sure. So antigens are anything. They don't necessarily have to be a bad guy. They don't have to be something.
It could just be like literally like
anything that's not me.
Like
right?
You get a splinter and that's inside your body. It's broken through your first layer, and that's not flagged as Jason.
So yeah, your kidney can be an antigen. A splinter can be an antigen. A disease can be an antigen, right? Mm-hmm. We get more specific with that antigen definition. We break it down into pathogens, allergens, things like that, right? Mm-hmm. So a pathogen is a disease, right? It's a bacteria or a virus. It is a pathological antigen.
It will cause disease if left
right. And some of them are organisms, some of them aren't really, right? But they're things that are trying to hurt us, right? And then an allergen would basically be an antigen that isn't a pathogen. It's not flagged as us, so it's an antigen. And it's not dangerous, but our body treats it as a major pathogen, basically. It attacks it. So that's something that we have hypersensitivity to, which we can talk a little bit when we talk about when inflammation can get away from us later in the podcast. So when we say antigen, we're just talking about a foreign body. When we say pathogen, we're talking about a specific virus or bacteria, a pathological antigen. And then when we talk about allergen, we're talking about it could be pollen, it could be grass, it could be something that isn't going to hurt us, but our body's response to
inappropriately
is inappropriate. Yeah, okay. And that then can hurt us, and that's when our body is acting against us. And that's where I think that we're going to go with this. We're going to get a little bit deeper and talk about, okay, so sometimes our body's defenses can get us into trouble, and then we have to act on those defenses. But then we're acting on our defenses, and that can hurt us, right? Sure. So we'll get into it.
So let's say an antigen, so some kind of non-Jason, non-Chris, entity has gotten into our body for whatever reason, whether we got a cut, whether we inhaled some droplets, whether we, anything like that, we got a blood transfusion that had weird stuff. Some type of antigen gets into our body. We said that it's now broken through that first layer of defense, right? It's gotten past the mucous membranes and the skin and all that kind of stuff. So what happens? We were saying the first thing that happens is our body reacts just as general inflammation. It's the general approach, right? We're not getting specific yet to that, like attacking that individual thing and making antibodies and using our helper T cells and B cells and all that stuff.
And this is part of our immune system,
right? That's why people say.
But this is why I like to separate this. This is the inflammatory response versus the immune response.
Right. So this always happens first. So what happens? So tell us what the couple
and why it happens. And I think that's what we just kind of don't know. Like, we know fluid happens, right? When I swell. Like it hurts and there's fluid, and we know that that's involved. But I don't think we really get why that's happening. Sure, it's designed to help us. So 4 major things happen. The first is that the vessels in that area of the local injury or the bacteria, and that's another thing too, is I think we chalk swelling up a lot of times to injury, and we don't really think about it in terms of like an antigen or a bacteria or something like that. That could be, this could be an infection. This is our first line of defense and infection too, right? But the first thing that happens is our vessels are going to dilate. So the vessels are going to get bigger, and the purpose of that is what?
So the vessels dilate for a couple of reasons. So the vessels dilate to slow down the blood, right? So if you'd have like water going through a hose and you put your finger over it, right, it starts coming out like faster and stronger. So when you make that area smaller, it comes out. So if we dilate that out, it starts to slow.
Yeah, we decrease the pressure in that area, right?
In the area.
In that little area.
And again, we're talking about local right now. We're talking about local inflammatory responses. We'll get into what happens if this happens systemically, but this is in the local level. So those vessels dilate to slow down the blood flow.
And that adds fluid to that area, because whenever we open up the vessels, we have relatively more fluid, and that's a partial reason for the swelling.
Right, yeah.
Right? The second thing that happens then, and so the reason, why do we want to slow things down? Well, this gives us time, and it gives us time to get white blood cells or lymphocytes into that area. And then, so our infection fighters, right, our army, can get to that area. And these are more of our general fighters. These aren't the guys who are making specific antibodies to fight a specific bacteria, like in the immune response. This is like the phagocytes or phagocytes. They just come in and they eat stuff, right? They just eat bad stuff.
Well, and that's the thing, too. And that's what people have to realize, that there's like, however many different types of white blood cells. Some of them are involved in that inflammatory response. They're more general, like you said, more general fighters of antigens or things that aren't supposed to be there. And then there are more specific white blood cells that learn how to target specific things, right? So in this inflammatory response, again, we get these
white blood cells are still
involved.
It's just not. It's still considered in the inflammatory versus the immune response,
right? And we use the term white blood cells, and it's kind of a general term because there's different types of white blood cells. I think this is why people do get confused with like, are we talking about infection? Are we talking about inflammation? Like, well, they're all kind of a part of this cascade, right? So in the beginning here, we dilate those vessels out. It slows things down. That allows those, like I said, those white blood cells, those general white blood cells to get to the area, and then they have time to get into the tissue.
And they can kind of get together, right? Like it's given times for, it's like in a fight. You don't want to start a fight without a bunch of your buddies, right? So it gives you time in this fight to gather up your buddies before you go in the bar and you beat the crap out of somebody, right?
I saw this text where this person was like sent this text to his girlfriend and said, send nudes. Or sorry, she said send dudes. And she's like, do you mean nudes? He's like, no, I need dudes. I'm in a fight. I need more people. It's like that kind of thing, right? The white blood cells are waiting for more
get
people
some backup, and then we can all kind of go in together. So that's why we're slowing things down to clump these together and get the infection or injury, either the healers or the fighters in the right spot. The second thing goes along with this, really the second and third, is that our vessels become leaky. All right, we hear this a lot, and this is a textbook thing a lot. I think people know that. Oh yeah, the capillaries become leaky. Like we don't really know why or how though. So let's dig a little bit deeper and just go back to the basics with it. Is the reason the vessels get leaky? What we mean by that is that there's opening in vessels that allow fluid to shift into the surrounding tissue, right? So we have our vessels as our superhighway that's connected to the whole system, right? We got to get the white blood cells and the fluid out of there to push the white blood cells into the tissue where there's the issue, right? Mm-hmm. I didn't mean for that to rhyme, but it sounded pretty sexy. So the tissue where the issue is. So then what happens is these vessels become more leaky, and this is usually activated by like chemical transmitters like histamine and things like that cause these vessels to become leaky, and then that allows the white blood cells to get into the area to be able to go fight to get into the bar and start the fight, right?
And leaky, and that's what we're talking about. So when we're talking about leaking, like what are we leaking? We're leaking fluid, so plasma from the blood, and we're leaking some of those white blood cells into the tissue then. And that's part of the dilation thing too. So when the vessel dilates, all those cells that make up the wall of that vessel get kind of pulled apart a little bit as it gets bigger, and that allows spaces in between them for those white blood cells to kind of like, slide in and slide through.
And that really relates to the third thing that happens is that endothelial cells are going to help on the lining of that vessel, are going to help basically white blood cells get into that tissue. We act like it's a step 1, step 2, step 3, step 4. It's all happening at the same time, and it's all relatively doing the same thing. We're trying to get white blood cells in there to help, right?
And the thing, and like I said, this may be a little too in depth, but just as a general thing. So what's causing this all to happen is these like you were saying, like histamine. That kind of, you don't necessarily, I think, for this sake of this podcast, you don't have to remember the individual different chemical receptors and things, but there are certain chemicals and certain things that our cells release in response to foreign antigens that then cause these things to happen. Right. So it's like when we talk about a cascade of events, like you said, it happens all very quickly and kind of all at the same time, but it's this thing triggers this thing, and then this whole thing happens. So,
and we've got like basically, guards that sit around in our cells, and their job is just to recognize, hey, that's not of me. I'm releasing histamine, right? Right. So like that's what they do, and then that histamine, and along with other chemical mediators, start doing this. Yeah. So we got dilation of vessels. We've got leakiness of those vessels. We've got these endothelial cells helping kind of making those openings and pull into that tissue. And then the last thing that can happen is microclotting. And microclotting is cool. This is basically, same thing as any type of clot, platelet plugs here and there around the area in the capillaries, in that tissue, to prevent the infection, basically keeping the battle there in the bar, right? We don't want the infection to get out. And if that infection or that pathogen,
not even necessarily infection,
right?
Any the foreign material, right? Want to use it as
if that pathogen or antigen gets into our highway, into that bloodstream, well, now it can travel other places, and we want to try to keep the battle here, right? Mm-hmm. So again, back to basics, keeping it simple. Inflammation has four major things that happen: dilation of vessels to slow things down and allow white blood cells to clump there; leaky vessels to get those white blood cells into the bar to have the fight, right? endothelial cells helping people pull into the bar, basically bouncers pulling them in, right? And then the fourth thing, microclotting, closing off the exits so that we can keep the fight in the bar, right?
Yeah,
and that's what the inflammatory response does. That's why it's helpful, right? It's all for our protection. And again, we kind of treat it as, oh, it's a symptom that we need to treat. We need to lower this inflammation because it's making me sore, right? So just respect your body a little bit in the sense that, hey, it's doing things to really help you out. Right.
Well, and then I think that kind of relates to the symptoms we get. So let's talk a little bit so this inflammatory response causes some things to happen, right? So when we dilate vessels and we have more fluid, it means that we have more blood flow to that area, right? So the area will get warm a lot of times, right? You think about like when you twist your knee and all of a sudden it swells, right? It swells because we got more fluid. It's also warm because you got more blood flow because you've slowed these things down and dilated it. So you get warmth, you get swelling, and then you get pain a lot of times as well. And the pain, I think, without getting too in depth, the pain is from, obviously stretching of that tissue from swelling. All that chemicals that are being released in that area can trigger the pain receptors and things like that too. So you get that kind of pain, swelling, and warmth. And that can happen if it's a foreign body that's bacteria that's going to cause infection. We see that in infections, right? Warmth, obviously with infection we get redness as well, but like warmth, swelling, pain. And if we just have an injury, right? Yeah. Then again, that inflammatory response is our general approach, our body's general approach to taking care of that and healing our body in some way, whether it's an injury, whether it's an infection, whether it's something like that.
Right. And there are cells, the same thing. We have to dilate those vessels and create the inflammatory response to get not just infection fighters, but also healers and repairers to get to that area too. And that's why inflammation is going to happen with injury where there's no antigen exposed and also infection or infection risk.
Yeah,
so
pathogens.
So when then is inflammation a bad thing? Like when does it actually turn into a bad thing is what I want to talk about next, because there are times that now that we understand that process and why we're doing it, I think we do need to recognize as medics and EMTs and pre-hospital providers and then ER docs and ER nurses, especially in emergency medicine. It extends way beyond that though, because you can talk about burn care and all sorts of things. Yeah. But when inflammation is dangerous to our entire body's function.
I mean, you could actually argue that you never see a patient unless they're faking it, that doesn't have inflammation. Right? Right. If inflammation is our body's initial response to any type of anything, that's when we get called as providers, right? So really everybody has this kind of thing going on a little bit. So
the danger though is that we talked about this happening at a local level, right? So we have dilation of vessels and we've got fluid moving. What the danger is if this happens in enough places at once, that's where we get into trouble, right? So when we talk about an entire system having a response, we refer to that as a systemic response, right? So when we talk about systemic inflammation, now we're talking about our entire system or our entire body suffering from inflammation. Now there's a number of things that can cause systemic inflammation. We'll give you a few examples today just so you can have that light bulb go on a little bit, where we need to respond to and kind of fight against the inflammatory response, because it's now the mechanisms that are going to help us out. Since it's happening on such a large scale, it's actually going to hurt us in the long run, and we'll explain why.
Well, and I think it goes back to what our role is as emergency providers, right? So what is our role is to either, and like I said, you kind of said it earlier, and I'll say it again, that our bodies are way better at healing themselves and taking care of themselves than we are as, emergency providers in doing it for it. Right? Like we even with fluid resuscitation, I tell my patients this all the time. People are like, man, I'm really dehydrated. You drinking water is going to hydrate you way faster and in a much more efficient way than me giving you IV fluids. Yeah. And me giving you blood pressure medicine is a lot less effective in controlling your blood pressure than your own diet and exercise. And your body always does a better job for the most part, right?
Most of the meds that we use, right, are pretty much already chemicals that the body's made for us, right? So we're not, epinephrine isn't we didn't invent it, right? It's adrenaline. We took it out of our own bodies, right?
Right.
It's synthetic and we processed it, but
exactly
we're copying the body constantly because the body is the best at taking care of itself.
Right. So our role as emergency providers becomes either assisting the body, and I think if we shift the way we look at medicine a little bit in this way, it can kind of help us. Like our role is to either help the body along its own process, right? Or to stop the body when it gets out of balance and try to help keep it in balance.
Right.
And when we talk about systemic reactions, so in systemic inflammation, that's where our body's defense mechanisms have essentially gotten out of hand, right? And if they get too far out of hand, they get past the point of no return, and we can't get them back. So our job becomes to try to keep our body within its parameters of homeostasis and to help it along its own processes. And I think if we can see ourselves as that with that kind of role, then it starts to make more sense to us why we'd give certain medications during certain times, or why we'd give a medication in this instance that we wouldn't in this instance. And it's all about that balance. It's all about how do we keep the body within that level of balance and homeostasis and help the body along with its own processes.
Yeah, and when I teach this, when I teach about systemic inflammation or systemic responses in general, I think the best example, because we're just so familiar with it, a lot of times is anaphylaxis.
Sure.
So like, anaphylaxis is a good example of how systemic inflammation, or at least a facet of it, can cause a big issue, right? So anaphylaxis, first and foremost, let's just realize that it's a hypersensitivity reaction. So the antigen that we're dealing with isn't really actually harmful to our body, right? It's an allergen now, and it's our body's response to it. It's treating it like, oh my gosh, not only is there pollen in you, it's everywhere. We have to fight it everywhere now, right?
Again, it's almost like it's hypersensitivity. So like our body is sensitive to certain things. It should be, right? Like it's why we, in someone who's not hypersensitive to like peanut butter, for instance, right? Like my son William, he's got a peanut allergy. So when I eat peanut butter, nothing really happens, right? When he eats peanut butter, his body sees it as like tags it as like a threat, where again, so it becomes an allergen. So it's something that normally, like you said, wouldn't cause harm to the body, but the body sees it as causing harm and reacts in that way.
Yeah. So is it an antigen? Yes, it's an antigen in your body, my body, and Will's body, right? In Will's body, though, it's also an allergen.
Right.
A special type of antigen called an allergen.
Exactly.
It causes this hypersensitivity. So what happens is the body fights it like it would fight any foreign body, and it activates the inflammatory response. And the danger in anaphylaxis, the major danger is... That rhyme too?
Yeah, man.
You're just really good today.
The major break out into danger, a rap about inflammatory response.
Here we go, drop a beat. So the major danger is that the vessels dilate, and that dilation of vessels, if that happens everywhere, well, that's going to slow down flow everywhere, right? You said yourself, we dilate those vessels to get fluid to that area. Well, if the fluid's all rushing into the tissues in all these individual parts, it's no longer in my vessels, right? Mm-hmm. So my blood pressure now has dropped, and I can't circulate blood well, which means I can't perfuse tissue because there's not oxygen in the right places, right? It's everywhere.
Which what you're describing then is shock, right? Your body is going into shock.
It's a systemic issue, right? So now we have systemic relative hypovolemia, right? Like I like to refer to like hypotension. It's a relative hypovolemia, right? We have the same amount of fluid, but it's in the wrong spot, right? Mm-hmm. It's all dumped into the tissues to try to fight these would-be invaders,
right?
And now it's not in our system. It's not on the highway, and it's not keeping the pressure up.
It's distributed everywhere.
So we call it distributive shock.
Exactly.
And we'll talk about that when we get into shock.
It's all coming together. So, and that's the other thing too, is that we, again, our role then as ER and emergency providers, EMS, is to get the body back into that balanced state, right? Try to get this is a hypersensitivity and overreaction, if you will, of the body to something that's foreign that shouldn't be bothering it as bad as it is. So our job is to try to get that back into play. So again, this is where we start to have to look at, what therapies can we use to try to get that patient back into balance. And it's going to be a lot of different things and kind of playing with things sometimes, right?
Well,
playing with
it's
fluids,
the lesser of two evils a lot of times, mm-hmm. right? Because what's the big treatment for anaphylaxis? What's going to really fix it is epinephrine. Epinephrine's our go-to drug, but what does epinephrine do? So this shows us an example of when we take what we think is just the all-out solution to it, but really it's a double-edged sword. I give them epinephrine. That's going to constrict those vessels. That's great right now because now the fluid is, the pressure's back up, the fluid's back in the vessels, we're good to go.
We're perfusing
I give them antihistamines to try to calm down that inflammatory response. That's great. But what do some of those medications do? What else does epinephrine do? Well, it increases my heart rate, right? Increases my breathing rate. It's a beta agonist. So it's also going to tax my heart. unnecessarily, right? And so you see a lot of times with like registry prep and stuff, people are like, well, do I want to give epinephrine and anaphylaxis because that's dangerous because they could get a high heart rate and then have a heart attack or something like that. Well, that's true, but it's life over limb here, right? Where anaphylaxis is what has to get treated first. So epinephrine is the right way to go, but it's a double-edged sword. This isn't like stopping a bleed or giving an antibiotic. Like, it's not a very simple treatment where it's like, this is the solution and it only helps. We're hindering body functions or activating other body functions that can work against it.
And same with fluids, right? So you've got someone who has this distributive shock, right? They've distributed their fluid everywhere. Their blood pressure is low. So in the short term, you want to give them a little bit of fluid to bring that blood pressure up so they can perfuse their heart and their brain. But you're also just giving them more fluid, which is going to cause more sweat. So it's again, right. It's trying to get the body back to balance. How do we balance these things? Which is why it's not always cut and dry. Like, people say, well, like, you know, I might give a liter of fluid in the emergency department, and then I might give a second liter, and then I start to listen to their lungs, and I hear them retaining fluid in their lungs, so then I back off the fluid. It's like, I'm not doing anything wrong, but I'm almost playing this game with the body of like, how do we keep you in balance long enough that we can get everything under control back to where it was?
And right there is the perfect example of what makes you an expert in it versus just a basic provider, right? So I don't want our listeners to think that don't give fluid now if someone's in distributive shock, right? No, that's still the solution. It absolutely is. But an expert can say, okay, I'm giving fluid for this. The answer, you know, to A is B. But I'm also watching now for risks of fluid overload too, because I know what the mechanisms that are working in my body, and I know the mechanisms of what I'm giving the body. I know what that's doing, and then how that can be too much or set them off balance on the other side, right? An expert gives epinephrine and anaphylaxis every time because it's the solution to it, but understands I might need to watch for cardiac arrhythmias or, you know, too fast of a heart rate or other, you know, beta agonist type issues because I just amped this patient up. We start to see medicine from a different perspective now and start to analyze it as an expert rather than just, hey, the solution.
Yeah, my protocol says to give fluids,
yeah,
but give
I'm
fluids.
just gonna, you know, that's the.
It's not wrong.
A monkey could do our job if that's how we want to do our job.
Right.
And sometimes that's the solution, is to do very simple fixes. You know, we build algorithms and stuff like that in ACLS to give simple fixes, but we do need to come back now as providers, analyze this information, understand it better so that we can become experts. So then when you've got a patient who's got third-degree burns all over his body and the solution was to give him fluid, now he starts to suffer from fluid overload, you know what to do then too, right? Or you can at least pass that information on to the ER doc or the next level of provider and say, hey, I'm recognizing this issue, right? I think that's what medicine is all about. That's what turns medicine from science to an art, right? It's understanding that.
Right.
So,
and that's actually, like, that brings us to that side project that you and I started, training monkeys.
No.
You don't remember?
I told you I didn't want to invest in that.
Wait.
It's just too much.
What?
$17,000. So anyway, the anaphylaxis is a good example of that, right? So two other things that are good examples of how we can have systemic inflammation.
Yeah, you just mentioned burns, right?
Yeah,
so let's talk about burns.
Burns causes like an easy distributive shock, right? Local injury. So this is an example of injury now, not necessarily disease processes.
Not pathogens.
Not pathogens,
right?
not
injury,
antigens, but injury in general that causes fluid everywhere, right? If you burn enough of your body, all of those little areas, the vessels dilate. We start to try to get cells there to heal that area and repair. Well, now relatively, I'm systemically hypovolemic, right? Or I'm having a problem with distributive shock. So that's another example. And then another would just be sepsis, right? When an infection, when that microclotting, when we tried to keep things in the bar, and that didn't work or we didn't do fast enough, and that infection gets into my circulatory system, that infection goes everywhere, right? Now I have an inflammatory response that's happening in multiple areas or all of the areas, could be either, right? And that's where we run into a systemic infection, which we refer to as sepsis, right?
Well, and it's also, we've also kind of defined SIRS too, right? So SIRS, I don't know if you guys are familiar with, but like SIRS criteria is systemic inflammatory response syndrome, right? So SIRS criteria, things like high heart rate, high respiratory rate, signs and symptoms that you have a systemic inflammatory response. If then we can say, hey, you know what? It's because of X, Y, or Z pathogen, or like it's because of your pneumonia or your UTI. Now we have a source of infection. Now we call it sepsis. Right. So again, we just kind of, that systemic inflammatory response syndrome, or SIRS, is like us trying to figure out, you know, recognize that there's a systemic inflammatory response happening so that we can address it the way you and I just discussed. And then if we realize or find a source of that as an infectious source, now we're calling it sepsis.
Right.
It's kind of how we're defining those terms a little bit.
And this is, I think it's kind of fun because it all starts to come together now, right? So now it's not just like, you understand why as an emergency provider, I would deal with a lot of fluid and stuff because I'm trying to handle hypovolemic issues or relative hypotensive issues, right? Because of this inflammatory response. But then you are going to have to deal with the consequences of that. I give them a bunch of fluid. Now they're fluid overloaded. You're going to have to deal more long-term with balancing that fluid out, right? So I just think it takes it to the next level and it starts helping us become experts when we understand not the pathophysiology of a disease, but understand how our defense mechanisms in our body works and then how that can act against us. What I'd like to go into further in another podcast sometime is now start talking about the immune response, the other side of this, right? Mm-hmm. We know physical barriers. We know the inflammatory response. Now let's talk a little bit about the immune response. Not now, well, next episode or next time. But We'll talk about the immune response and how that can get carried away, right? When my body gets flagged.
I'm like, nope, everybody grab a coffee. We're going to jump into the this is going to be a 3-hour podcast. Let's go.
So now my body is, you can have autoimmune diseases where my body's fighting itself. What's the solution to that? I'll give a medication that suppresses the immune system. Mm-hmm. Well, that's not just the end-all, be-all fix. I just suppress your immune system. Now what are you at risk for? Well, getting normal infections, right?
Yeah.
So it just helps us to understand medicine from this balance perspective, this homeostasis perspective, where sometimes our treatments do cause a little bit of harm, and we have to watch how we balance those out. Mm-hmm. But I know we're kind of running out of time here, so I want to make sure that we close it up, and hopefully that you guys gained something from this and learned a little bit about the inflammatory response and how it has a little bit of a bad rap. But you got to understand what it's doing for us. Right, exactly. And again, like taking it back to basics is understanding those 4 things that happen in inflammation, why they're important, right? Why you need to have them occur. And then again, to then approach your patients and approach diseases and pathology and body's responses maybe from a different angle, right? Again, the goal here today is to try to kind of have you, one, understand the inflammatory response well in a simplified fashion. I think hopefully we've done that. But then also to realize that, maybe if we step back and look at ourselves as more of these, helpers of the body itself, like can we help the body along its own processes? Can we help keep it in balance? All of a sudden, our therapies start to make more sense, and all of a sudden, we get to start that process of becoming not just a cookie cutter, follow the protocol, follow the algorithm, but really understand why we're doing those things so that when those things aren't working, we also know what to do next and that sort of thing. Right. So, I mean, and we could get into it even deeper with like our advanced providers. You start talking about like push dose pressors, and now you see why we balance fluids with maybe some trying to kind of augment all these things together. Right. Right. And that's what medicine's all about, right? And that's what education's all about, to edify you and to get you to understand this stuff so that you can be a better provider out in the field.
Awesome. Cool.
So, all right, go over our sponsor one more time.
Yeah. So registryready.com, powered by Sites and Sirens. So registryready.com, again, question banks, lots of different questions for prepping for your national registry. Check that out, registryready.com. And again, if you guys need any further prep for your national registry exam, we would like to pitch our program to you. You get to meet with Jason and I every week or two, and we give some live lectures. You get access to about 15 hours of videos and obviously these practice questions and a workbook. And we'd love to help you on your journey of passing that exam if you need that help. Thank you guys for listening, and we will see you next time.
Stay sweet. Chris, drop a beat. Hey guys, hope you enjoyed the episode. If you're an EMT or medic student, or an advanced EMT student, or an instructor of those students, we have a program just for you. With Sites and Sirens NREMT Prep Program, you get video lectures, over 15 hours of really vetted, great content to help you through your program and help you prepare for the test. Check it out at www.sitesandsirens.com.